Hello, we're from SGD B10 and will present about genetics in diabetes. My name is Krisna Paramita Karimea with name 170. So diabetes is one of the most common diseases worldwide with vascular complications that have a high mortality rate among the patients. There are genetic factors that contribute to each type of diabetes. Genetic variations also cause diabetic patients with otherwise similar clinical features, glucose control, and treatment appear to have different susceptibility towards complications. Understanding the role of genetics in diabetes is important in the effort to reduce the incidence of diabetes and its complications because patients with susceptible genes can be more aware of their susceptibility and will do better to prevent diabetes or its complications. Reducing the incidence of diabetes and its complications will contribute to reduced mortality rate and medical expenditure. It will also enhance individuals' quality of life. Therefore, this paper is aimed to explore the genetic aspects behind diabetes in order to enhance the understanding behind genetics in diabetes. The purpose of this writing is to find the answers for these questions, including first, what is diabetes? Second, how are the epidemiology, pathophysiology, signs and symptoms, diagnosis, laboratory findings, treatment, complications, and the preventions of type 1 and type 2 diabetes? How is the role of genetics in diabetes type 1? And how's the role of genetics in diabetes type 2? The benefits of this writing are publicly be able to prevent or manage diabetes according to individuals' genetic susceptibility. Medical community can further understand about each type of diabetes, especially the role of genetics behind each respective type, and thus may be able to plan the best prevention or early detection plan for each individual. And lastly, authors can enhance their knowledge about the role of genetics in diabetes and will be able to fulfill the student project assignment in the endocrine block of Faculty of Medicine, Udayana University.
My name is Udayana with student number 228. I will explain about the definition of diabetes mellitus. So diabetes mellitus is a metabolic disease that develops from a lack control of blood glucose level. It is a syndrome that disturbs metabolism characterized by persistent high blood glucose levels or hyperglycemia. Despite many risk factors that may increase the blood glucose level, insulin deficiency or insulin resistance may become a primary cause of diabetes mellitus due to its effect on multiple macromolecule metabolism in our body. Diabetes mellitus can be classified into two major classes, namely type 1 diabetes mellitus or T1DM and type 2 diabetes mellitus or T2DM. T1DM results from defective insulin secretion due to autoimmune derived destruction of the insulin producing beta cells in the islet of Langerhans. The genetic predisposition, infection, toxin, and other external factors may trigger the autoimmune mechanism. Meanwhile, the 2TDM results mainly from insulin resistance due to an unhealthy diet and sedentary lifestyle. In the first period, the lack of insulin response countered by an increase in insulin secretion, but over time, the insulin secretion will decrease.
My name is Shannon Kalista, name 015. Now I would like to continue the presentation. Okay, let's start from the type 1 diabetes mellitus. First of all, I will talk about the epidemiology of type 1 diabetes mellitus. So, the incidence of type 1 diabetes mellitus varies between countries and within a country. In some of the Western countries, cases of type 1 diabetes mellitus occur in 5 to 10% of all cases with diabetes, and more than 90% of people with diabetes in children and adolescents are type 1 diabetes. The highest incidence, approximately 40 out of 100,000 per year in Finland, with the peak of T1DM incidence is in the age of 5 till 6 years old and 11 years old. It is also known that genetics such as HLA system and environmental factors such as toxin and virus play a significant role in the development of T1DM incidence. In Indonesia itself, in the year 2000 and 2010, the incidence of T1DM increased 7 times in children and adolescents. Based on data from Ikatan Dokter Anak Indonesia in 2018, there are 2,220 of children who are diagnosed with T1DM. Moreover, it is also known that in the year 2017, number of T1DM children with diabetic ketoacidosis reached 71% due to lack of awareness of public and healthcare workers. T1DM cases were still remain undiagnosed or misdiagnosed until this day. This is why we need to increase the awareness of type 1 diabetes mellitus by improving the capacity to detect and managing T1DM in Indonesia to prevent death in children.
My name is Puturahari Natalia Anggreni with student number 217. So the pathophysiology of type 1 diabetes mellitus I will explain to you right now. Deficiency of insulin secretion which result in metabolic disorder in IDDM patient. IDDM is the other name of diabetes mellitus type 1 is caused by autoimmune destruction of beta cells. Not only in insulin secretion reduced, but pancreatic alpha cell function is also abnormal and excessive glucagon secretion occurs in IDDM patient. Hyperglycemia usually result in reduced glucagon secretion. However, in patients with IDDM, hyperglycemia does not result in reduced glucagon secretion. Improperly elevated glucagon levels can exacerbate metabolic defect caused by insulin deficiency.
My name is Melin and my last digit number is 093, and now I will discuss about the diagnosis and laboratory test of T1DM. The foundation of T1DM diagnosis based on insulinopenia, T1DM symptoms, and the evidence of beta cell targeted autoimmunity. Then for laboratory tests, we can use such as FBG, 2-hour PG, A1C, random plasma glucose, and also we can find autoantibody. If there are autoantibodies that present, it can be diagnosed as autoimmune T1DM. The symptoms of T1DM are like polydipsia, polyuria, weight loss, headache, and often ketoacidosis. And this is a table for the criteria for diagnosis of diabetes by American Diabetes Association 2021. And we can move to the management of T1DM. The goals of the management are to promote healthy living and controlling glycemic to prevent from getting diabetic ketoacidosis or severe hyperglycemic. Patients with young age who got diabetic ketoacidosis need to be treated immediately with initial food resuscitation. Then for correcting the acidosis and dehydration, we can give such as insulin infusion and electrolyte replacement. And we can also control glycemic concentration by insulin treatment, and we need to remember to manage the nutritional status by taking healthy foods and physical exercise.
My name is Aurelius Robertus Novito with student number 128. I will explain about the prevention of type 1 diabetes mellitus. The prevention has two types, primary and secondary type. The primary prevention is before the appearance of islet targeting autoantibodies, and the second type is after the appearance of one or more islet targeting autoantibodies but before the symptom onset. The primary prevention includes trigger study, FINDIA, high-dose oral insulin administration to babies with genetic risk, oral insulin and intravenous or subcutaneous insulin administration, and baby diet and trial nutritional intervention to prevent type 1 diabetes. These studies has shown no success, but high-dose oral insulin administration successfully increased IgG binding to insulin and CD4 plus T-proliferative responses to insulin, and oral insulin and intravenous or subcutaneous insulin administration showed projected delayed diabetes onset of 4.8 years in certain patient condition. The secondary prevention includes the oral insulin administration, which delayed the onset of type 1 diabetes mellitus in individuals with high levels of insulin autoantibody, and DPT1, DIPP, and ENDIT showed no protective effects. And then we move on to type 2 diabetes mellitus. The epidemiology of type 2 diabetes mellitus. What is the estimated number? The estimated number, 450 million people were estimated to have diabetes, and 90% or more from that had type 2 diabetes mellitus. Estimated 318 million people have a preclinical impaired glucose regulation and increases all-cause mortality risk by 15%. Most people have contributing factors, commonly Western diet and sedentary lifestyle, which is proved by the high incidence of diabetes in developed countries such as Italy and United States. And according to the genetic factor, common variants of glycemic genetic traits has been identified, but only accounts for 10% of total genetic trait variants. And the transcriptomics technology found large numbers of gene association between obesity and diabetes. Lastly, there is an aggressive phenotype that has been identified in young people, which is 15 to 30 years, who is diagnosed with type 2 diabetes. So, type 2 diabetes mellitus occurs commonly in sedentary lifestyle and obesity, which proved by the high incidence of diabetes and supported by the findings about the genetic factors. Thank you.
Hello doctors and friends, my name is Giovanna Raffensya Purnama with student number 148 and I will explain about the pathophysiology of diabetes type 2. So diabetes mellitus type 2 was known as non-insulin dependent, and it is well known as a multifactorial metabolic syndrome caused by significant increase of glucose and lipid levels in blood. The accumulation of carbohydrate, protein, and fat in our body will disrupt normal metabolic system, resulting diabetes signs and symptoms such as polyuria, polydipsia, and polyphagia. Oxidative stress is highly correlated to diabetes mellitus type 2 and its complication. Oxidative stress can cause insulin resistance, impaired insulin secretion, and abnormal glucose metabolism in liver and utilization of glucose in cells. Oxidative stress will activate inflammatory agents and demolish the cell via glucose metabolic pathways. Diabetes type 2 mainly acquired due to unhealthy lifestyle, changes in daily diet, and lack of physical activity.
Hello, my name is Anish Sharma with name last three digits 251. Type 2 diabetes is usually diagnosed using glycated hemoglobin test, also known as A1C test. If the results show that the percentage is 6.5 or more, it indicates that the patient is suffering from type 2 diabetes. If the glycated hemoglobin test is not suitable for a particular patient, there are other tests which may be used, such as random blood sugar test, fasting blood sugar test, oral glucose tolerance test, and also screening. The treatment for type 2 diabetes involves pharmacological methods as well as non-pharmacological methods. For the non-pharmacological methods, usually involves a healthy eating, such as having a proper diet, regular exercises, which includes swimming, walking, aerobic, and running, and also weight loss. For the pharmacological ways, it includes medications such as metformin, GLP-1 receptors, sulfonylureas, SGLT2 inhibitors, and also DPP4 inhibitors.
My name is Morgan with name 057. I presented about the prevention of diabetes mellitus type 2. Nearly all people get pre-diabetes before they get type 2 diabetes. Pre-diabetes is a condition in which their blood sugar is elevated from normal but are not high enough to be diagnosed as a diabetes. There's a CDC prevention program which could avoid or postpone pre-diabetes by changing their lifestyle, such as manage to change lifestyle with a competent coach, do a minimum 30 minutes of physical exercise for 5 days in a week, determine how to handle stress and stay motivated, lose weight by losing 5 to 7% of the initial weight could avoid or prevent diabetes, and consume healthy diet, which consumes smaller portion of diet to lower the amount of calories.
My name is David, number 74. I will explain role of genetics in type 2 diabetes mellitus. So, heredity factors play big role in diabetes type 2 factors. Diabetes type 2 itself categorized as polygenic disorder caused by the development due to complex genes and environmental interaction factors. New study only referred to genes called B10 and transcription factor 7 like 2 that not associated with diabetes type 2. CAPN10 became the first discovered gene that related to diabetes type 2. Until this time, the function of this gene in glucose metabolism vectors remain unclear. The number of single nucleotide polymorphism in the TCF7L2 associated with type 2 diabetes mellitus. These genes affect insulin secretion and glucose production. Although it has more risk of mutation, several factors as predictors that this mutation will develop into type 2 diabetes. That's all for role of genetics in type 2 diabetes mellitus.
My name is Inyuman Yuga Yoga with name 109. I will explain about the summary of this presentation. Diabetes mellitus is metabolic disease that develops from lack of control of blood glucose level. It can be classified into two major classes, type 1 and type 2 diabetes mellitus. Type 1 diabetes mellitus originates with autoantibody disorder. It can be managed by controlling the glycemic level to prevent severe hyperglycemics by using insulin treatment. For the type 2 diabetes mellitus, it has been believed to emerge due to rising trend of obesity, physical inactivity, and energy-dense diet. It can be diagnosed by glucose blood test and be treated by healthy eating, regular exercise, and weight loss. That's our presentation for this topic. Thank you for listening.